Mary had a little lamb.
The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream today. Change has come to America.
Believe it.
Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show.
Turn up your mind.
Hello, everybody. It's Friday, you bastards. Yay. Friday the 13th. Oh, my God. Hoard your bread. We're all going to die. Oh. So there are now 1,920 cases of coronavirus and 41 deaths inside the United States. Donald Trump is about to declare some sort of an emergency. More accurately, he's going to have to admit that there's a national emergency. And then he'll probably say, that I had nothing to do with. It's not my fault. It's the Chinese and the Europeans and the Italians over there, because he won't know the difference, But that's what they keep saying, that this is, one emergency that Trump did not create on his own. So that would be true, but he sure made it what it is because he didn't want the numbers. He didn't want to do the tests. He didn't want the numbers. 13 people inside the White House, close to the president, have spoken to Politico, to Dan Diamond over at Politico, who actually was able to tell the story of how Trump only wanted to hear what he wanted to hear, didn't want to hear what he didn't want to hear, and therefore would not react to any proactive measures to keep coronavirus from being a community spreading disease. So, hey, all you people who voted for Donald Trump back in 2016 because you wanted to shake things up, you wanted to shake is this enough shaking for you? Is it enough shaking for you? Now, I have no idea what he's going to say. What does declaring a national emergency that he should have declared 6 weeks ago look like for him? What does it look like, smell like, taste like? What does it sound like? Are we going to be able to move freely about the country? Are we not going to be able to? All I could tell, Ted Cruz is self-quarantining. Lindsey Graham is self-quarantining because they interacted with some people who tested positive. It's the first time these two have ever been associated with anything positive. I just want to say, positivity is not their thing. So you have that. Bolsonaro, apparently there was a rumor that he had it, and then he celebrated today when he was tested. Brazil, you can get tested. Here, not so much. So just so you know, here are the numbers, okay? South Korea has tested over 230,000 people. Italy has tested 86,000 people. The best number that we can, get from anywhere is 13,000 people tested in the United States, but nobody knows whether or not to believe it. Can I just tell you that 6 months before H1N1, the swine flu, remember that? That was very deadly. That was a serious freaking virus. The Obama administration declared swine flu, or H1N1, a public health emergency 6 weeks before it was declared a pandemic by the World Health Organization. 6 weeks before. At that time, 0 deaths had been recorded from H1N1 in the United States. 0. 6 months after that official declaration, when more than 1,000 deaths did occur, Obama declared H1N1 a national emergency. Fox News is reporting this exactly backwards. They are saying that Obama didn't declare a national emergency on swine flu until after 6 months had passed, when the World Health Organization declared a pandemic. Now, that was flagged. That post was flagged as part of Facebook's efforts to combat fake news and bad information on its news feed. But the article was printed on Printly. Printly describes itself as a conservative news website that defends Donald Trump. And that article is full of misrepresentations, untruths, and outright lies. And it goes on to say that it wasn't until 6 months after H1N1 became a global pandemic that, quote, then President Barack Obama declared a public health emergency on what was already a pandemic. By that time, the disease had infected millions of Americans, and more than 1,000 people in the United States had died. Okay, that is completely ass backwards. The timeline is ass backwards. It's not only wrong, but it is distorting and promoting propaganda, a false narrative. Just so you know, H1N1 was a very deadly disease. It came from pigs. That's why, hence the name swine flu, and it comes from pigs in North America, and it was serious. There were 60.8 million cases of swine flu, 274,304 hospitalizations, and 12,469 deaths. That's the CDC. The Obama administration had declared 2 emergency declarations. He acted before the pandemic was even declared a pandemic, and his director of Health and Human Services declared H1N1 a public health emergency. The date is April 26, 2009, and that was when there were 0 deaths inside the United States. 2 days later, the Obama administration made an initial funding request for H1N1 to Congress. 2 days later, this is before it was declared a pandemic, and $7.65 billion was allocated for a vaccine and other measures. On June 11th, 6 weeks later, the World Health Organization declared H1N1 a pandemic. In other words, the Obama's public health emergency declaration came more than 6 weeks before the World Health Organization declared a pandemic, and we still had all these people contracting it and dying from it. So whatever happens here is going to be determined by what Donald Trump did not do 6 weeks before. You know, the whole time that, this was a known thing, he actually addressed it in his State of the Union. He said he was working strongly and closely with China. He knew about this. But he decided that he would attack prosecutors, he would attack judges, he would defend Roger Stone, he would fire people, he would make, he tweeted and tweeted and tweeted about Democrats and Little Mike and Sleepy Joe. And I mean, he right, that's what was, in his head. He did absolutely nothing. So now we are doing what we're doing to save ourselves, because we know that it's here. And we know that there are very few tests. And we know that doctors are frustrated because patients have been turned away who have this and who have the symptoms and who have been tested for 21 varieties of flu, including H1N1, and aren't testing positive for any of those kinds of flu. So they're deducing that these are patients with coronaviruses, but then when they ask for tests to be performed, they are being denied. They are being told that their patients don't meet the criteria, or there aren't enough tests to go around, or the precursor for the test, this reagent is missing from the test. So you can't pull out the genetic material from the virus itself to look at the mapping of the RNA, which is where this virus lives, in the RNA of the molecule, right? They can't do it. Because this person hadn't been to China, or this person doesn't know if they've been in contact with anybody who has it. So, I don't know what he's going to say today. All I could tell you is this declaration, this emergency declaration, should have been declared during the State of the Union, because he knew about it. And instead he decided to tweet about himself, to tweet about his opponents, to tweet about the Bidens, to tweet about Mike Bloomberg, to tweet about, anything and everything except to warn the American people. Also, before we go to break, I just want to tell you today is the last day for the Spring Pledge Drive for Free Speech TV. Please visit freespeechtv.org/donate and, donate what you can, or call 877-378-8669. 877-378-8669. Thank you very much.
All things Randi at RandiRhodes.com.
Go for launch.
Speaking truth to power, The Randi Rhodes Show.
The one criticism that seems valid seems to be that we were slow. We didn't have enough test kits available. The president mentioned that has since been rectified. A, is it rectified, and why didn't we have them more quickly?
Yeah, so the CDC invented a test within 2 weeks of China posting the genetic sequence, and we've developed the test, and it's been available, and we've had actually capacity at all times to do testing for people that needed to be tested. But it has not worked as well as we would like. We have 4.5 million tests out there. There are a surplus of tests out there, but the connection from the patient, doctor, hospital to those lab tests and the labs has not been as seamless as we'd like.
Oh, my God. There's a surplus of tests, everybody, okay? Here's Dr. Natalie Azar.
I just tried to get a patient tested an hour ago, and I couldn't in my outpatient office.
In your opinion, that person should have been tested.
I would have liked to test her. I shouldn't have even said her, but it's one of those things where was my clinical suspicion the highest it's ever been? No. Was it way down here? No. The message that we got from the only place that we're currently doing it is the emergency department, and they don't have enough. They said we can only do it if the patient is sick enough to require hospitalization. And I was dumbfounded. I've been covering this story for weeks now, and I'm sure we all are getting very mixed signals. Oh, LabCorp is testing, and millions of tests are getting rolled out. And that's all fine and good until I finally was in my office today. I thought, I can't get my patient tested. And I really would have liked to.
Wow, that is amazing. And there are doctors all over this country that are trying to get themselves tested, either because they have symptoms and they're trying to protect. One doctor was in North Carolina, and he's married to a nurse. And he obviously is treating patients, and he had symptoms, and he wanted to get a test, and he couldn't get a test. He wanted to get a test to protect his patients and to protect his wife, who is also a nurse, and she wanted to be able to be cleared so she could tend to patients. You think it's hard to get toilet paper? Wait until you can't get a doctor. Wait. Because without testing, the amount of effort that is going to be required to contain is exponentially higher than with testing. With testing, people, well, they'll be told to go home and suffer. That's just a gimme, right? I mean, I was listening to a doctor last night, actually, and he was saying, okay, so, what do you do? When do you go to the hospital? When do you go to the doctor? And, of course, this guy is like the head of the ER for a giant medical group called NYU Langone. If the Langone name sounds familiar to you, it's because he owns Home Depot and now our medical system. And the ER doctor was saying, Chris Hayes kept asking him. So he said to him, I went home. There was somebody I loved who was having, fever and dry cough. And this person was saying, I think I got it. When do you go to the hospital? And he was like, never. No, you never go. You know what you do? You go home, you take some ibuprofen, and you tough it out on your own. I mean,
and how do I know when it's time to go to the ER if I start to feel really bad?
Right. So as was mentioned earlier, is we're all keeping an eye on the overall capacity of the healthcare system, both locally and in the United States. So it's going to be really important that everyone works to match their level of symptoms with their level of care. So, for example, people who are well or have very mild symptoms, it's going to be really important to go to sites like the local health department or the CDC to understand what's going on with you and how you can
the websites.
The websites, yep.
Go to a website.
And then for people with more moderate symptoms, it's important to utilize some telehealth platforms or telephonic platforms to be able to continue to self-isolate, but to seek evaluation and consult. And then certainly for people with severe symptoms like respiratory distress, those are the people that we really need to have using the 911 system and the emergency system.
Okay, so what I'm hearing from you is it's very important to keep people that don't need emergency care out of your ER. Is that a fair thing to say?
That will allow us to take the best care of the sickest people.
Okay, so if I'm 30 years old and I've got a fever and flu-like symptoms and I'm holed up in my apartment, I'm drinking a lot of fluids, I'm taking ibuprofen, what you're saying is stay there, stay away from people, and maybe check in with your doctor through telehealth if you can.
That's right, just like you would if you had influenza or if you had a bad cold.
Oh, my God. Go to the basement, everybody. Go to the basement and suffer in silence. Go to the basement. If you have the internets and you have health care and you have a health insurance plan that allows for teledocs, right? Call them. Call them up and tell them, how bad. And they'll tell you, take 2 tax cuts and call me in the morning. Holy crap. You know what's left out of that explanation? The test. When do you go to get a test? Where do you go to get a test? You're not allowed to go to your hospital. You're not allowed to go to the ER. You're not allowed to go to your doctor anymore. You now have to just tough it out in your basement with your toilet paper stash and your rice and beans, which, by the way, it depends who did the shopping yesterday, okay? So I went to the store and Howard went to the store, just so you know. There are completely different priorities between the man and the woman, at least in my household. All right? Howard said, I'm going to Costco. He went to Panic at the Costco, everybody. He went to the Costco because he felt sure that they would have giant packages of toilet paper that would last through the ages, that would get him through the apocalypse that he thinks is coming. I went to the regular grocery store, Publix, right, because I just wanted to pick up some food things, some food items, and, maybe a couple of rolls of toilet paper, enough to last for 2 weeks, because that's pretty much, if you have to self-isolate, that's what and this is the answer, self-isolate, go in the basement. So I thought, well, Florida, we don't have basement, so if I have to lay on the bathroom floor, because the tile is cool and everything, I would like some TP. Apparently everybody in the world had the same idea, but there are hoarders out there. It's very sick. Anyway, you know what he came home with? He came home with, and this is Costco-sized stuff, right? So like barrels of chips, 4 giant, and they were all connected with the plastic at the top, so you can't even separate. 4 giant ketchups. No, I'm not. 4 giant ketchups, like 9 boxes of pasta all wrapped together. 2 giant things of 250 feet of Reynolds wrap, 2 of them wrapped together. A giant no-name brand paper towel that had, 4,000 rolls of paper towels, and nuts. That's what Howard wants when the apocalypse comes. He wants chips, pretzels, nuts, pasta, ketchup, and paper towels. There was no toilet paper. I went shopping. I bought vegetables. I bought soup, rice, beans, protein bars, and some chicken and some, chopped meat to make, burgers, tacos, things like that. This is the difference between the genders. I have to, at least in my house. I mean, I'm thinking meals. And he's thinking ketchup and nuts. I just, wow. People are going to go to the emergency room because they have an upset stomach from eating too many chips dipped in ketchup and pasta. I mean, wow. That was, wow.
Connect. To speak to Randi, call 561-270-3844. 561-270-3844.
I'm sorry, I apologize, but this could be, a very big moment for the United States. So, Trump is speaking. It's a press conference. I think there will be questions. And he just started, and so far what he said was he saved many, many, many lives, a tremendous amount of lives, because he closed travel from China. This is where he's at right now, and so we'll listen in.
Very important, and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation. and we're working very strongly with many states, including New York.
Strongly.
The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible.
Oh my
It
God.
gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action today, we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week.
Supposed to have 4
we'll
million
be announcing
today.
locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country. Stores in virtually every location.
He doesn't know what he's talking
Google
about.
has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days.
6 days.
And what we've done is we built something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public.
Yeah.
He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that could meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country.
All right. She is a very well-respected person. Why she's, kissing his butt without a face mask on, I think that's dangerous. I just do. Oh, my God. 6 days ago they met. 6 days ago.
This is the Randi Rhodes Show. To speak with Randi, dial 561-270-3844. That's 561-270-3844.
Okay, so we have a president who shut down the global health security team in the National Security Council, and so there's no one but his son-in-law to advise him when a global pandemic, makes it to our shores. He doesn't care about whether people live or die. He just wants the numbers to look good for him. He wanted the number of cases to be kept on the low side. And it wasn't until the stock market imploded that he actually sat up and said, okay, I need to tell the American people something. And he gave some chock full of lies and misinformation, distortions, things that needed to be clarified and corrected, creating more panic and chaos to the point where you could see the stock indices in real time with each word he uttered tanking. And now today, he has surrounded himself with every retailer you could possibly imagine. That's who's addressing the nation right now on a health pandemic. He just had McMillan from Walmart. He's got all of the... Look, this is so sick.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
You're ramping up now?
Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very much.
Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control, and we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you.
the next few weeks, okay? This is unacceptable. This is absolutely a disaster. And all of this because the president didn't want tests. He wanted the numbers to look good for him. He didn't want an election year pandemic. He didn't want high numbers. He wanted to be able to say he saved lives by shutting down the borders, which he misspelled in his tweet weeks ago. About China. I mean, this is unbelievable. So you are watching an experiment play out in real time. On one side, you got governments like Singapore, Japan, South Korea, China, Hong Kong, who have already pushed out money to their people. Hong Kong is already sending checks to the people of Hong Kong. Japan, same thing. You've got surveillance, you've got institutional resources, you've got leaders at the bully pulpit, you've got financial stimulus and smart quarantines going on in all these countries. And here, in the next couple of weeks, the private labs are hoping they'll be able to do testing in a couple of weeks. This is just an amazing failure. Now, the reason why we're going to track the way that Italy looks is because Italy has a messy, squabbling government. They took a piecemeal approach the way we took a piecemeal approach, and that led to their whole country being shut down. Same thing, Iran. Iran lied to their people. They dissembled. The state officials that were sent out distorted reality. And now we can see satellite images that our intelligence community is able to take of burial trenches being dug for the dead from the COVID virus. So we're right up there with Italy and Iran, the United States. 63 million Americans voted for this man. For this man. Why? Because they felt the government was either not doing enough for them or because they liked the feeling of breaking things. I hope this is broken enough for you, because there ain't no toilet paper anywhere in the United States today. Oh my God. Yes, we have an imperfect system. Let's, keep reforming it. Let's keep moving forward. Let's get ourselves into the 21st century. But to take a sledgehammer and for him to gut everyone in the National Security Council that deals with pandemics, you got former Homeland Security officials, you got the former Assistant Secretary of Homeland Security, Juliette Kayyem, who teaches how to respond to disasters at Harvard. They can't put their pens to the paper fast enough to tell you that this is not what it's supposed to look like. This is not supposed to be what a response to a pandemic that you knew about months ago should look like today. That's why we have these massive disruptions. We have these massive disruptions in the way we do things because we're on our own. And so individual, arenas and pleasure parks, Disney, Busch Gardens, they're all shutting down to keep us protected from each other because the president failed to do it. We're having to shut down our country piecemeal because the president refused to do testing, because the president refused to order, any antiviral medications, refused to make sure that tests worked, that the reagents worked, and that there was plenty of supply to get ahead of it, to get out in front of it. I mean, and when they fact-checked that televised address from the other night, he failed so miserably. He failed so miserably. It was a public relations effort, and the investors in this country, smart money in this country, they knew that the president was inadequate, that his response was going to fall short, and that the private sector was going to have to do what the president would not do, and that they were now at a point where everything had to be shut down to keep people from coming in contact with each other. Our government is positioned to deal with terror attacks and hurricanes and oil spills and disease outbreaks. And listen, all disasters are messy. Every last one that you could think of was messy. But poor performance and lack of preparedness adds to the disaster, adds to the messiness, adds to the death toll. Look at Katrina, okay? That was a disaster. That was very messy. That was handled poorly. And over 1,000 people had to die in that small city. I mean, but by the time our federal government got involved, it was too late. And so now we're having to fight over toilet paper. I'm telling you, this is so unacceptable. Everything about this is just bizarro world. Bizarre. Here's an old lady smacking a woman yesterday over a roll of toilet paper. She smacked her.
Don't treat her like that. Are you okay?
I got the toilet paper that I needed. She smacked a bitch. This old lady smacked a woman over a pack of toilet paper. Here's a hoarder versus a woman who just wanted, one package. Somebody's got an entire cart full of toilet. Watch this.
Hey, stop! That's enough!
Look at this cart. She's got 2 carts full of hoarding toilet paper.
Excuse me? Go away from my daughter. Please. I just want 1 pack. No, not 1 pack. What's the limit?
I just want 1 package.
Guys, I need everyone to back off right now.
I need everyone to back off right now. I just want 1 pack. She had 2 shopping carts full of like 24 packs of toilet paper. Hoarder. And screaming and yelling and fighting. And you want to see toilet paper justice, though? This is my favorite one. Toilet paper justice, everybody. There's a little old lady. He's pushing her away. Oh, look at that there. Yeah, toilet paper justice. I mean, what kind of a country are you looking for? That 63 million Americans were looking for. They wanted the status quo shaken up. I hope this is enough shaken for you. Oh my God. So you have a government that's supposed to be ready. A government that has been ready. We went through, various pandemics. But this one looks like 1918 because the president is an idiot. The president is a liar. The president fired everybody. So we're wondering, which agencies are going to provide how much aid, how many people are, have this disease, how many hospital beds, how many shelter beds, how many meals, how many rolls of toilet paper, how many gallons of water are available. And we have an administration that is untethered from reality. That's it.
Mary had a little man. The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream today. Change has come to America.
Believe it. Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show. Turn up your mind.
You want to see how things really get done? You want to see the difference between Donald Trump's fumfering around and lying and suppressing information and twisting information and saying was testing very strongly. Anybody who wants a test can get a test. We have a surplus of tests. And the reality on the ground where doctors are saying, I had a patient in my office today an hour ago, and I couldn't get her a test. Oh, I shouldn't have even said her, right? And Donald Trump saying, it'll go away. It'll just wash through. It's going to disappear and downplay. Okay, I want to show you how things really need to look so that you'll have a comparison. Yesterday, Katie Porter, who's running for re-election, in California, obviously, she questioned Dr. Redfield, and she questioned one of the doctors from the military and asked them if they understood their power, what they already are entitled to do with regard to providing free testing to every single American. This is an amazing clip. Watch this.
Dr. Kadlec, For someone without insurance, do you know the out-of-pocket cost of a complete blood count test?
No, ma'am, not immediately.
Do you have a ballpark?
With a copay, ma'am?
With a copay?
No, the out-of-pocket, just the typical cost.
I do not, ma'am.
Okay, a CBC typically costs about $36. What about the out-of-pocket cost for a complete metabolic panel?
Ma'am, I'd have to pass on that as well.
You have any idea? You want to take a ballpark?
I would say $75.
Okay, 58.
Getting closer.
How about flu A? The flu A test.
Ma'am, I would take a guess at about maybe 50.
43. Flu, this is like the Price is Right. Flu B.
Too high again. I would probably say 44.
That's good. How about the cost of an ER visit for someone identified as high severity and threat?
I'm sorry, ma'am. What was the question again?
How about the cost of an ER visit for somebody identified as having high severity or high threat?
High severity, but ma'am, that's probably about $3,000 to $5,000.
Okay. Oh. That is $1,151. This all totals up to $1,331. That's assuming they aren't kept in isolation. Isolation can add up for one family already, $4,000. And fear of these costs are going to keep people from being tested, from getting the care they need, and from keeping their communities safe. We live in a world where 40% of Americans cannot even afford a $400 unexpected expense. We live in a world where 33% of Americans put off medical treatment last year. And we have a $1,331 expense, conservatively, just for testing for the coronavirus. Dr. Redfield, do you want to know who has the coronavirus and who doesn't?
Yes.
Not just rich people, but everybody who might have the virus?
All of America.
Dr. Redfield, are you familiar with 42 CFR 71.30, excuse me? 42 CFR 71.30. The Code of Federal Regulations that applies to the CDC. 42 CFR 71.30.
I think if you could frame what it talks about, that would help me. I don't relate.
Dr. Redfield, I'm pretty well known as a questioner on the Hill for not tipping my hand. I literally communicated to your office last night and received confirmation that I was going to be asking you about 42 CFR 71.30. This provides the director may authorize payment for the care and treatment of individuals subject to medical exam, quarantine, isolation, and conditional release.
That I know about, and my office did tell me that. I just didn't know the numbers, ma'am. That's Congresswoman.
Great, so you're familiar. Dr. Redfield, will you commit to the CDC right now using that existing authority to pay for diagnostic testing free to every American regardless of insurance?
Well, I can say that we're going to do everything to make sure everybody can get the care they need.
Reclaiming my time. Dr. Redfield, you have the existing authority. Will you commit right now to using the authority that you have vested in you under law that provides in a public health emergency for testing, treatment, exam, isolation without cost, yes or no?
What I'm going to say is I'm going to review it in detail with CDC and the department.
Reclaiming my time. Dr. Redfield, respectfully, I wrote you this letter along with my colleagues, Rosa DeLaura and Lauren Underwood, Congressman Underwood and Congressman DeLaura. We wrote you this letter 1 week ago. We quoted that existing authority to you, and we laid out this problem. We asked for a response yesterday. The deadline and the time for delay has passed. Will you commit to invoking your existing authority under 42 CFR 71.30 to provide for coronavirus testing for every American regardless of insurance coverage?
What I was trying to say is that CDC is working with HHS now to see how we operationalize that.
Dr. Redfield, I hope that answer weighs heavily on you, because it is going to weigh very heavily on me and on every American family.
Our intent is to make sure every American gets the care and treatment they need at this time of this major epidemic, and I'm currently working with HHS to see how to best operationalize it.
Dr. Redfield, you don't need to do any work to operationalize. You need to make a commitment to the American people so they come in to get tested. You can operationalize the payment structure tomorrow.
I think you're an excellent questioner, so my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance. Please, if you believe you have the illness, follow precautions. Call first. Do everything the CDC and Dr. Fauci, God bless you, for guiding Americans in this time. But do not let a lack of insurance worsen this crisis.
That was amazing. That was everything. Everything. She got the head of the CDC to commit to paying for every American to get tested. There is no work that he had to do to say yes to that. The work is how he disperses the payments to the labs that actually process the tests, and he could do that tomorrow, she said. Now, the president, on the other hand, he's still out there. He's still out there in the Rose Garden now, telling people that, I don't know, in the next couple of weeks, Quest will be able to process tests. In the next couple of weeks, LabCorp will be able to process tests. In the next few weeks, the guy who needs to provide the reagent, he says, oh, I'm ramping up, some sort of, a kit. I'm going to ramp it up. And Roche has come up with an alternative kit, but it's like having a Mac or a PC. You know the difference, right? I mean, this is easy to explain if I say it this way. You know that a lot of the stuff that you have running on your Mac doesn't work well on your PC, and vice versa. That's the deal with the reagents and the kits that they have now versus the new kits with a reagent provided by Roche. The equipment in the lab isn't compatible with the Roche test the way it was with the test that was developed in Germany and also some factory in Maryland that they're ramping up production for this. This is so lame. They are weeks behind. Weeks behind. And the next 6 weeks for this country is going to be pure hell. Everybody has to prepare for impact over the next 6 weeks. The president just authorized tests for people who are symptomatic. You know what the problem with that is, don't you? Yeah. The problem with that is that this particular virus is communicable in asymptomatic people that don't show symptoms. You know, everything that they're doing is just pathetic. Just pathetic. People cannot get tested. That is the answer to come and to understand and to isolate and to get treatment for people with.
Things Randi at RandiRhodes.com.
Go for launch.
Speaking truth to power, the Randi Rhodes Show.
Oh, here's a doozy of an exchange. This is Kristen Wolke from NBC.
So no, and what we have done, and we are going to be leaving a very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody. And frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers.
Mr. President,
and
with
interestingly,
respect,
if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people.
12.
And they didn't do the testing. They started thinking about testing when it was far too late.
Oh, my God.
What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early. And we've also kept a lot of people out.
Mr. President,
yes,
the
please,
last administration
please.
said that they had tested 1 million people at this point. You've been
Well, ask them how they did with the swine flu. It was a disaster.
But with respect, you've been
Next, please.
For 3 years,
Next,
and
please.
Wuhan was suffering.
They had a very big failure with swine flu, a very big failure.
President, I want to ask you about the European travel ban that goes into effect at midnight tonight and the exemption that you've offered to the UK.
Go ahead.
Thank you, Mr. President. I'm a correspondent with Hong Kong Phoenix TV.
Yeah, go ahead, please.
Thank you, Mr. President. You spoke with Canadian Prime Minister Trudeau yesterday.
Yes,
Did you discuss the potential closing of the border between Canada and the U.S.? And by extension, are you considering ways to salvage the $2 billion daily trade between the two countries?
So we didn't discuss the border. We've had a very good relationship, just about finished with.
All right. You get the idea. All right. Let me just tell you something. Again, Barack Obama declared a pandemic over swine flu 6 weeks before the World Health Organization declared swine flu a pandemic. It was serious. On April 12th, the United States knew that there were 60.8 million cases of swine flu in the world. There was an enormous reaction from the United States. President Obama declared a public health emergency 6 weeks before this was declared a pandemic. Here you have a president who months into knowing that China had closed down the city of Wuhan, knowing that South Korea had begun drive-through testing and had already tested 200,000 people. The president is saying maybe on Sunday we'll see some tests. Do you get this man is so irresponsible, such a liar, such a complete failure as a human being, let alone as a leader. I will tell you, swine flu was very, very, very serious. There were 274,000 hospitalizations, 12,469 people died from swine flu, and that is with a proactive approach 6 weeks before it became a pandemic. That's why I'm saying buckle up. We don't know what kind of disease this actually will turn out to be. We only know that to what they say, flatten the curve, meaning the load on our healthcare system should be flattened. The load should be diminished by giving people tests so that they know who needs to isolate and who can move freely about the country. It would help the economic situation. It would help people send their kids to school. It would help people go to work. It would help people stay home from work. It would help the spread that they call community spread. It would totally impact the numbers of people who contract it, who die from it, and who pass it on to others. This man is a failure. He is a failure. There were literally no deaths from H1N1 when Barack Obama declared his emergency, okay? Here in the United States, you have almost 2,000 people infected, 41 deaths, and the president is telling you next week. You'll see, next week. And this idea that we weren't built to send out antivirals, that we weren't built to do testing, that we weren't built, that's a lie too. We were built for that. Donald Trump just decided to fire everybody. And now we have acting directors everywhere and his son-in-law.
Call in, connect. To speak to Randi, call 561-270-3844. 561-270-3844.
All right. Last day of the spring pledge drive for Free Speech TV. If you can, please reach into your pocket and underwrite these independent shows that bring you the truth, that fact check, that are not receiving any corporate money and that do not take any government handouts. Just go to freespeech.org/donate, freespeech.org/donate, or you can dial the phone, 877-378-8669. 877-378-8669, and let's finish this pledge drive up on a positive note. Because all of the other stuff is just so daunting and negative. All right, so thank you very much. Everybody in Colorado would appreciate it. Their support is what makes us able to distribute on their platform. So thank you so much. Steve in Indiana.
Hi.
Hey.
Randy.
Hey.
I don't understand why they don't use the test kits from Germany and all these other countries. They're that test kit, isn't it the one where it just gives you an immediate result?
So other countries are not going to give the United States anything as long as they need these tests for their own population. And so the Donald has squandered all of the goodwill of the world to begin with. He has trashed everybody. And so, we can't get the kind of supplies that we need.
Yeah, this man, if people vote for him again, they are the stupidest damn people in the world.
I know.
And this man is a scumbag.
Yeah, he absolutely, positively only cares about his own political future. That's it. But remember, he's doing whatever he can so that he can stay out of jail. I mean, that is his motivation.
Everything's goodly.
Strongly.
Yeah.
It's all strong. And he knows all the best people,
Oh, yeah.
Yeah, and everyone that, was the best is either in jail, awaiting sentencing, or fired. I mean, there's no one left.
Yes.
So it's
Yes,
just
ma'am.
really sad, I'm reading stories from all over the country. Here's one in Washington, D.C. Doctors repeatedly declined to test a woman who got sick after spending 3 days with a delegation that was visiting from her country's home office in northern Italy. The quote from her husband is, quote, "I realize healthcare is an imperfect process, but this is just kind of ridiculous. He's been sick for 1.5 weeks with the symptoms, and his wife can't get any help." So, there's a story about a doctor at Wakefield in North Carolina. Again, I told you, him and his wife, he's a doctor, she's a nurse. They come in contact with patients every single day. He had symptoms. He asked for a test. He couldn't get one. He's sidelined. His wife, the nurse, is sidelined. You had in Indiana an emergency room doctor at a community hospital. She said that she tried to get 3 patients tested. 2 of those after the CDC liberalized their guidelines. She said both patients had flu-like symptoms. Both had CAT scans that showed lung problems that are consistent with COVID-19. Both were in severe enough distress that they needed to be admitted to the hospital. Both also tested negative for a panel of 20 other common respiratory viruses, but neither of them had traveled outside the country or could say that they were aware that they had been in contact with a confirmed infected person. And when the doctor called the state health department to request testing for these 3 patients who had all of these symptoms and all of these test results, they denied the tests. She said, quote, "Since I watched all 3 cases get denied, it made me realize they're not testing anyone." She had to speak on condition of anonymity because she doesn't have permission from her corporate employer. All these groups now run by hedge funds and Home Depot. Marcy Klein of New Rochelle, New York, came down with a fever and a dry cough just as coronavirus, a cluster, transformed her Westchester County town into the nation's first containment zone. A week later, still hacking, just taking Tylenol to keep her temperature down, she went to get a test for the coronavirus. 64-year-old, worried about her husband, 71-year-old doctor with diabetes, did not meet the testing criteria. She said, "I don't want to feel like I'm giving the virus to anybody. I told you about D.C. This is just so unbelievable to me. Wednesday, 10 days after a woman fell ill in Alabama, she was finally able to get tested at an urgent care clinic. She was told 4 days to get the results." Thomas in Hawaii.
No, this is Rhonda.
Oh, Rhonda in Erie. Hi.
Yeah, hi.
Hey.
Except I'm not in Erie right now. I am driving to New Orleans to pick up the Surly team from college because they've gone completely online for the rest of the semester.
Yeah.
Yeah, and so has my university. Well, my university hasn't gone for the remainder of the semester. But this just goes to the point that you were making earlier, that we're having to do this for ourselves.
Yeah.
You know, each of these universities has closed on their own, or because the governor has closed it. So, you know, none of this is coming from the top down. It's all coming from the bottom up.
Yes. Yes, and we're having to do this to protect our own damn selves. It's like every company for themselves, every man for themselves, every woman for themselves, every kid. School's just been shut down here. I don't know how parents are going to deal with this because there's no paid sick leave. There's no checks going out to people. There is a $1.5 trillion bailout headed to Wall Street, which is what, you know, propped up the stock market a little bit today. I mean, this is so sick. Everything to the top. Everything to the top. Nothing for the middle class. Now, starting next week, like you're going to pick up your kids, people who need to work, what do they do with their kids who are in elementary school?
Exactly. I have a friend who has 2 little girls, and she's been keeping them home for the last 3 days.
Yeah.
And the school has actually been calling her saying, well, you know, they have unexcused absences, and she lives in Ohio. So yesterday, governor closed all the public schools. They did the same thing. It's like all the states I'm driving through. It's like it's following me. Ohio closed public schools yesterday.
Yeah.
Kentucky closed public schools yesterday. And, you know, my kid is at a school in New Orleans. There are no schools in the country that are better prepared for disasters than schools in New Orleans. It's a result of the aftermath of Katrina. And I still don't feel like she's completely safe.
Yeah, I hear you. This is ridiculous. This is a ridiculous situation we did not have to be in. We just have a liar and a cheat.
This is the Randi Rhodes Show. To speak with Randi, dial 561-270-3844. That's 561-270-3844.
Thank you, Mr. President. Yamiche Alcindor from PBS NewsHour. My first question is, you said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it.
He doesn't know.
I mean, you say we did that. I don't know anything about it.
You don't know about the
I
reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was an
Please go ahead.
What is he talking
We're doing
about?
a great job. Let me tell you, these professionals behind me and these great, incredible doctors and business people, the best in the world, and I can say that, whether it's retailers or labs or anything you want to say, these are the best in the world. We're doing a great job.
Oh, my God. He takes no responsibility for firing everyone at the National Security Council's pandemic. He did it. He actually, and they left because he fired them because Obama had put them together in response to 11 years ago, in response to what people learned from the H1N1 pandemic, where 60.8 million people were infected with that particular flu. It was a flu virus. I mean, he's just such a sick freak. I don't take any response. Maybe, Dr. Fauci, no. And you see Dr. Fauci go, I don't know, because the doctors, the real ones, the ones who, are trying their very best to work with somebody who doesn't want to hear bad news, who tries to paper over bad news, who tries to deny bad news, who tries to push it away, who doesn't react in time to prevent bad from becoming the worst, okay? They don't want to go to war with him because they need to be there, because if they weren't there, we'd be in worse shape. So instead, he praises Walmart, who doesn't, they pay slave wages. You know what I'm saying? There was nothing about sending out checks to people. There was nothing about helping people pay for treatment at the hospital. I mean, that happened in Congress. That you saw what that looks like. Katie Porter managed to get the head of the CDC, Dr. Redfield, to commit to paying for testing and treatment so people would not be afraid to go. Oh, just so sad. So freaking sad. All right, Thomas in Hawaii.
Hey, Randy, Trump made history today. Did you hear it?
Which?
He said, I take no responsibility. That's the first time in the White House he's told the truth. That's just a little humor because what I'm going to say next gets heavy.
Yeah.
What if I told you that there are 1 in 6 children in this country has a developmental disability, and that 54% of our children have chronic illnesses? What if I told you that? Well, what do you think brought that on, considering the fact that I'm 70 years old, and when I was in school, I didn't see any special needs children, except one who was my locker mate.
Because they didn't have special needs classes.
People.
Well, back in the day, when you were young, they didn't have special needs classes, and kids didn't get the kind of help that they need. Well, kids didn't get the kind of help that they need. That's why.
No. You're missing the point I'm trying to make.
You're saying
you're missing the point I'm trying to. I'm trying to say that they weren't there.
Who wasn't there?
I'm trying to say that they weren't there.
Who wasn't there? Who
because
wasn't there?
The special needs children.
So
they
we
weren't
didn't have
there.
any children with disabilities 70 years ago. Okay, all right.
Nothing like we have now.
How do you know? We didn't.
How do I know? I'm looking at.
We didn't
well,
test
if you let me talk, I'll tell you.
All right.
If you let me talk, I'll tell you how I know.
All right.
In the 1980s, there were 11% of our children, 11% with chronic illnesses. Right now, according to a Health and Human Services funded publication, 54% of our children have chronic illnesses. From the 80s at 12% to now 54%. Why? Why? I mean, I have a really good idea why.
Okay, tell me why.
It's vaccines, and you're probably going to think I'm crazy.
Yeah, everybody thinks you're crazy because the truth is we didn't test for any of these things. Did we have autism spectrum back then? Did we have tests for cognitive disabilities? Did we have tests for I had a cousin. He died early. Obviously, he had Down syndrome. There was you either put him in an institution or you kept him at home. So I don't understand your point. We didn't do anything to test children to find out why. We had no test for dyslexia. We had no test for autism. We had no test for ADD. We had no test for ADHD. We didn't know what was wrong back then. You just kind of said, oh, well, he can't sit still, or oh, well, this, that. Oh, he has high highs and low lows. And no one knew what bipolar disorder was. Nobody knew anything about anything. So if you start testing, then you find. And that's exactly Trump's approach to this virus. Don't test, we won't know. Now we test, and now we know. But there are people that don't want to know. There are people that preferred it the way it was. Just let these kids fall through the cracks. Just let them live a mediocre life instead of the best life that they can live. Instead of a productive life, a happy life, a life where they can communicate their hopes and dreams, where they perhaps have hidden talents. No, just don't test, don't find out, and just move along. I'm sorry, but that's a sick attitude. It's just so bad. Tom in Wisconsin.
Yes. Hello.
May I help you?
I was wondering what your thoughts would be about. My theory is that Trump and Putin are using this virus as a germ warfare to try and disrupt the next election.
I've heard that. I don't have any proof that that is true or that that is the case or what will happen with the election. So until I see something that tells me, because you got, Jerry Falwell Jr. saying it was North Korea, they're doing bio war on us. You got Donald Trump, who's been insinuating it's China that's engaged in bio warfare. You have you now saying that you think it's Russia. I mean, what in the world? Why can't we just stick to what we know, which is bad enough?
I just don't want to see the next election get screwed up by the Russians or the North Koreans or the Chinese or Saudi Arabia or anybody else.
Well, then stay involved and stay aware and have situational awareness, situational alertness.
Yeah, that's what I do. I vote straight ticket all the time.
No, I mean, pay attention to newspapers that are reporting, for instance, that there are troll farms now acting at the behest of Russia located in Ghana, so that it will have a Ghana stamp on the internet, the internet fingerprint. So, just stay aware and know what is happening. Know that you have some of the best investigative journalists in the world right here in this country. And unless and until there is evidence and proof that this is somehow something that was inflicted on us to do X or Y, I'm not going there. I only go with what I got. I'm not Alex Jones. I don't wake up in the morning and drink or smoke or snort or shoot and then sit around and think of conspiracy theories and then sell toothpaste that claims to cure coronavirus. I mean, these are some evil freaking minds. Angela in New York.
Hi. I just want to talk about how I'm astounded at what's happening in New York City. There is going to be a disaster here. The schools are still open. The subways are still running. There are no plans to shut down anything. I work for a city agency, and I don't care if they hear this. They have not given us the option to work from home. They've not given us anything to protect ourselves, and we come into contact with a high-risk population every day. My children are being forced to go to school unless I pull them out. Wall Street's been taken care of. Broadway's been taken care of. Everybody's been taken care of, but they really don't give a crap about us who are working, who have children. It is disgusting.
We're in a situation, okay? And what we really need to have now is situational awareness. All you can do.